Hello everyone, I'm Andy Trotter, the Chair of Oxleas, and welcome to this year's Annual Recognition Awards. For the second year running, our awards ceremony has had to be a virtual event. Wherever you've joined us today, this is our opportunity to celebrate together the great work and achievements that has taken place across Oxleas. During the past year, the dedication, adaptability and resilience shown by our amazing colleagues has been humbling. We have seen teams truly embracing our new values. We're kind, we're fair, we listen when we care, despite the challenges this pandemic continues to bring. We remain committed to making Oxleas a fairer and more supportive place for everyone to work. For the benefit of both our patients and colleagues, we're taking positive steps to improve the experiences of those people waiting to use our services and the care we provide to them in the community settings. It's important that we recognise the lengths colleagues go to provide excellent patient care, and I'd like to say thank you to each and every member of Oxleas staff for the pride and expertise that you put into your work. For this year's Recognition Awards, I'm delighted to say that despite the continued pressures of COVID-19, we've had hundreds of submissions. And it's been a hard task for all the judging panels to pick their highly commended and overall winners for each category. So without further delay, over to our new Chief Executive, Ifya Kocha, and colleagues to announce the awards.
Thank you. And so the moment you've all been waiting for. The first three awards are from our Team of the Year award category. Each winning Team of the Year shows how they have put our new values, we're kind, we're fair, we listen, we care, into action, or have demonstrated improvements in quality and patient experience. We received a total of 168 nominations this year across the 7 Teams of the Year award categories. Visit our website to see who was nominated this year. Let's get started with our first award. This is the Team of the Year award for the Adult, Acute and Crisis Mental Health Directorate. The 3 shortlisted teams are the TAN. The TAN staff take patient experience very seriously and have arranged many successful events for their patients. Most recently was a fashion show, which was great for staff and patient interaction and a huge morale boost for Oxleas House. Patients have also enjoyed a movie night where it was great to see the patients relaxed and enjoying each other's company. Intensive home treatment team for older adults across Bexley, Bromley and Greenwich. The team maintained face-to-face and home visits during the pandemic as they were aware how difficult this patient group found virtual contacts. Staff have gone the extra mile for their patients, such as helping them with essential shopping when struggling during the periods of mental ill health. And Millbrook Ward. Millbrook Ward team have shown great leadership, creativity and innovation, bringing kindness, fairness, compassion and service user involvement to focus on 2 major quality improvement projects: safety in mental health settings and the sexual safety of staff. They've been part of the Quality Improvement National Collaborative Project. The projects resulted in implementation of new ideas to reduce restrictive practices and a sexual safety ward charter. Let's see who the winner is.
So I'm here, so prepare yourselves, I'm here to ask you some really difficult, challenging and searching questions about quality improvement. I'm not really. That's not why I'm here. The real reason I'm here is to congratulate Millbrook Ward because you are our Team of the Year for Team of the Year for Adult Acute and Crisis Mental Health. We're absolutely delighted with everything that you've done over the last year. It was an absolutely fantastic application that showed what brilliant stuff you've been doing around safety, around quality improvement, around sexual safety, so many brilliant things, and you were very, very worthy winners.
It was a fantastic team to be part of. I think everyone works so hard. People really love what they do on the ward, and we work as a very good team. So congratulations.
I think it's a fantastic achievement for the ward. It's testimony for all the work we've been putting in. I think Emma's been spearheading some really critical projects on the ward. They have a fantastic medical team who work well with helping to discharge understanding patients. Fantastic HCAs who seem to have an insight as to how to grab information.
What they've shown is that you can improve safety by involving service users, by involving carers, and through continuous quality improvement. We've had very good leadership from Emma as ward manager and Dr. Dawood as ward consultant, but as well, Wayne said, I think it's distributed leadership across the whole team. That's been fantastic to see.
We've gone through a lot of challenges in this last year, not to mention with COVID, but staffing with difficult patients that we've had on the ward, and I think the staff are really open to taking on innovations, to thinking differently about patients, to really being very carer-centred as well as person-centred. So it's just been a really lovely team to work with, and I think really well deserved.
But as we say in the African language, behind every great man there's a great woman as well. So, and behind this success there are fantastic managers and matrons who we can call upon at any time of the night and be able to, I sometimes wonder, say, wow, is that the role of the manager or the matron, that you can text them at middle of the night and they respond? Is fantastic. I feel so proud. I'm privileged to be part of this team.
I love, I respect, I appreciate the enthusiasm and the team, the collaborative feel that you guys have. Each one speaking on behalf of the other, saying how happy they are to be part of this team. I think that's the spirit we want, and brilliant. So congratulations, well done. Extremely proud of you guys.
You were compassionate with your patients. So it's not the environment, it's not, it is because you are compassionate. Then people, when they see somebody who's looking after them, they will come down.
Yeah.
So this is the key part. Looking after our patients, looking after ourselves, after each other, and be compassionate. Thank you. Thank you.
Congratulations to everyone on Millbrook Ward for a well-deserved award, and thanks to our Director of Strategy and People, Rachel Claire Evans, for springing the surprise. Praise must also go to our two highly commended teams, the TAN and the Intensive Home Treatment Team for older adults. Well done to these three teams, and indeed everyone who was nominated. And now, the Team Award for the Adult Community Mental Health Directorate. The three shortlisted teams are Greenwich Primary Care Plus Team. The team were nominated for their work supporting vulnerable people at a homeless hostel set up in Greenwich during the pandemic. They worked in partnership with Primary Care, Royal Borough of Greenwich, St Mungo, and Enabling Assessment Service London to make sure those in need received immediate access to health and social care. Bromley West ICMP team. In response to a challenging CQC inspection, the team have made substantial improvements to the quality of care that patients receive, implementing Fiscal health and well-being checks for people with serious mental illness on their caseload. The team were also nominated for the quality of their safeguarding work. And Bexley ICMP team, the team were nominated for their brilliant work supporting carers' engagement, proactive approaches to improve patient and carer experience, and their passion for patient care. The admin team have shown empathy and understanding, going above and beyond to support their colleagues and clients. Let's find out who the winner is. Is this better?
Yes, that's better.
Right, perhaps I ought to sit down then, so it seems as if I'm part of your meeting, right? Right, how's your meeting going?
Yep, going smoothly this morning, I think.
Hi, Mel. I know, I see a few familiar faces. So I thought I'll drop by, partly to see how it's going, but also to let you know that you've been nominated for an award. I'm sure you know that.
Oh. No, this is news
Not
to
just
us.
about nominated.
Really?
You didn't know that.
What is that about our team?
The nominated, and also you won. And the nominations were largely about the quality of fiscal healthcare you provide. So on the back of the CQC, all the work you've done, fantastic work, trained a lot of staff to the extent now that you're absolutely confident that your patients who need their health, particularly their ECG done, that's done. So that's fantastic. But also on account of your really fantastic safeguarding arrangements, which you're very proud of. So I thought I'll come along today to give you your award, which I shall hand to Anthony right behind. Ooh. Also, can you all see that?
Yeah.
That's amazing.
Okay, I'll hand that to Anthony. And I think that there are a number of other things that will be coming your way. Sadly, you're not all in the office. Those who are in the office will enjoy some goodies. I cannot promise you that they'll leave any of this for you, but hey, next time come in.
I did try to get them in.
Well, congratulations, ICMP. Really proud moment that you've been awarded this for all the hard work. So we're really proud here at Beckenham Beacon. Congratulations.
I would just like to say that is a wonderful morale boost for the team. I don't think we were expecting that at all. We've been through quite a lot of emotional roller coaster over the last few months with lots of long-standing members of the team who've left because the morale was really down. So this is amazing news to hear that our work that we do at the front line is actually being recognized.
You were the driving force behind us as well. You really were, and there were difficult times that we all faced, and to be quite honest, we were a really good team and we're all supporting each other. There's been tests and trials, but hey, we're coming through it, and thank you very much. It's really nice to hear some good news.
I mean, it's just a great introduction to the team, so thank you, and let the good work continue. Well done.
Well done.
It's great news, really nice for the team to get that, isn't it? And I know it's two areas of work that have very, very great importance, isn't it? So that feels marvellous. And I know lots of team members have contributed to that success, isn't it? They're, very aware of that hard work and attention that goes into that. So just brilliant work, team.
Yeah.
Fantastic. Well done. Well done, everyone. Congratulations to the Bromley West ICMP team. I'm glad I managed to meet you all, albeit some in person and some online. Congratulations also goes to our two highly commended teams, Greenwich Primary Care Plus team and Bexley ICMP. Well done to everyone in our Adult Community Mental Health Directorate. And now to the Adult Community Fiscal Health Team of the Year Award. These are the three shortlisted teams for the Adult Community Fiscal Health Directorate. Frailty Team. Established as a pilot in October 2020, this team is a partnership between Oxleas, Age UK, and Lewisham and Greenwich NHS Trust. Case managers and care navigators work as part of a multidisciplinary team to assess and manage a person with frailties problems, connecting primary care, community health services, adult care and social voluntary care organizations like never before. The team have received amazing feedback from a range of people, including patients, carers and GPs. Bexley and Greenwich Heart Failure and Cardiac Rehab Team. The team remodeled the service during the pandemic, being one of the first teams in the country to trial live virtual exercises. They have ensured that patients receive high-quality care and improved patient experience through cardiac health education and exercises. A number of patients described to us how the team have had such a positive impact on their lives. And our diabetes team, Greenwich and Bexley. The team are kind and considerate to each other and their clients, always putting the needs of the client first. They have helped other teams in Oxleas, and during Hypoglycemia Week, the diabetic nurses visited the Twilight service to give training and support. Always with the client at the heart, the team will change or adapt the way their service is delivered to ensure their clients receive a great service. Let's see who won.
Hello. Is this the frailty team? Yeah. So I'm here to congratulate you all for being the winners of the Adult Community Physical Health Team of the Year in the Staff Recognition Awards. So many congratulations to you all. So you thought you were here just to have your photograph taken. That's not why you're here. I've got to say, so I have read the nomination forms. People have been saying amazing things about what you've been doing since you were set up. So please feel really proud. The Frailty Team is a true example of integrated holistic care and care coordination in physical health that works for the benefit of the patient, the system and clinicians. One of the leaders, I'm not going to mention who, is an inspiring and extremely effective, and everyone, the team, the admin, the support workers and care managers are incredibly professional and kind. The team functions like clockwork of the very best kind. Like, Kerry is lovely, she helped me so much. Another one, don't worry doctor, Carol will sort this out for me, I'm sure. And then another one saying, Mum is under the Frailty Team, so I know that we're going to get lots of support. The Greenwich Frailty Team have been a godsend over the last 6 months. My wife has early onset dementia, which, as you can imagine, hasn't been easy to deal with. The team has helped in so many ways, making sure my wife's on the medication to phoning me every week to make sure I'm coping. And without them, I'm not sure I would have coped this last 6 months. Just knowing that they are there at the end of the phone anytime has made my life so much better.
Yeah, it's very emotional, thank you. I'd like to thank my mum, Helen Michelle. No, it's really good. Yeah, we've done a lot of hard work, so it's really nice it's paid off.
As a team, we've all worked really hard, and I think that it's really great testament to the work that's been done, and it's, I guess, more pleasing to know that, you know, patients and other services alike actually feel the way they do about our service. It's made it all worthwhile.
Now, we set the team up a year ago. It's a pilot team, and we set it up because there was a real gap in services in Greenwich. So it's a real pioneering team, and we're getting some great outcomes. So we're really pleased that people have nominated us for this award.
It's been interesting to listen to what they have been doing, and it's nice to hear that they've had such an impact on the community.
I just want to say, it's been great working in this team for the last year. We've made a difference in some of our patients' lives. We've had really good feedback from all of our patients. And yeah, we've made a real difference. It's just so good getting the whole MDT team together and being the integrated team where we can get everybody together and discuss what's best for the patient.
The MDT working has really worked well, and just want to say thank you to all my colleagues because we've really worked well together, and most of all the patients.
I'm really proud of the whole team pulling together in very difficult times to create a wonderful service for patients and for their carers. The support that the team is able to give day in, day out is amazing, and also extending that to our GP colleagues when they're at a time of significant stress as well. So just really, really proud of everything the team is doing and the way that they support not only patients and carers, but they support each other. It's a difficult role that we're doing in uncharted territory for a lot of us, working with so many different teams and colleagues across organisational boundaries. And I'm really proud of how everyone pulls together and supports each other.
I think you deserve a really big round of applause. Congratulations to the Frailty team. Congratulations to you all.
Thank you to everyone in the Frailty team for their incredible work. Thanks also to Rachel Claire Evans, our Director of Strategy and People, for helping us surprise the team. I'd like to give special recognition to our highly commended teams as well. Bexley and Greenwich Heart Failure and Cardiac Rehab team, and the Diabetes team, Greenwich and Bexley, who are also doing fantastic work to help people manage their long-term conditions in the community. Congratulations to you all.
Hello, I'm Kelly Rush. I'm here to announce the Shadow Executive Award. Our Shadow Executive Award is for an individual who has gone above and beyond to put the trust value, we're fair, into action. The winner has been chosen by members of our Shadow Executive. We were looking for an exceptional individual who embraces difference, treats everyone with respect, and promotes diversity, equality, and inclusion. Over 20 nominations were received for this new award category. The shortlist is as follows: Marlene Cork, Therapeutic Working Day Coordinator for Forensic Services. Marlene is retiring in December after over 40 years in our forensic services. Marlene is scrupulously fair and has always acted as an advocate for our forensic service users. Thanks to her, they've enjoyed a far richer and more therapeutic experience, thanks to the light and the colour that she brings. Cara Garrard, Greenwich Comres, Team Manager. Cara was nominated by a number of colleagues who told us how appreciative they are of how she listens to and supports the team, both in relation to work-related and personal issues. She always ensures that the patient's perspective is considered when making decisions in team meetings. Cara is a shining example of compassionate leadership and embraces the Trust's values. And Dr. Femi Adebayo, locum consultant psychiatrist for Greenwich West ADAPT team. Dr. Adebayo's understanding and support during this pandemic has been priceless. His kind and caring nature is outstanding. He's a pleasure to work with and one in a million, always putting others first. Where patients are concerned, Dr. Adebayo always ensures a fair decision is made on whether the team can accept their referral or not. He listens to patients and takes into consideration all of the issues they have. So let's see who the winner is.
Sorry to interrupt. Yeah, well, thank you. So I just met Kelly outside and she told us that Cara's here. And we're delighted, Cara, because you've been given an award by your team. So this is the Shadow Executive Award, given on the values of fairness, because many of you in your team have experienced you as being a very fair manager. And so we're delighted to give you an award, and we thought doing that in public would be a very nice thing to do to you.
Thank you.
Congratulations.
Thank you.
And we have some flowers.
Oh dear. I just wanted to say thanks to Cara for all of her support. I'm a lived experience practitioner and life can be a bit tricky at times, and Cara's just been a really supportive manager and very, very deserving of the Fairness Award from the Shadow Exec.
I'm a student in my final year and I'm placed in Commerce. Even before I came to Commerce, she sent me an email welcoming me to the team, which is really good. So before coming there, I was, I don't know how to put it, but I feel part of the team already because she has introduced herself. She makes me feel welcome. So thank you for that, Cara.
I've been in the CAMWES since it started, and I've known Cara for a while now. So when I saw the nomination, I was the first person, I think, to vote, that, she meets, she deserves it. She's been fair, kind, listen, no matter what situation, even with COVID time when it was difficult, she always have the time to listen.
I just want to say thank you, Cara, because actually she's a fair manager. She's always there to listen. I don't only see Cara as a manager, I see her as a friend as well, someone I can talk to. So well done, Cara.
So I'm Alex. I have the very good fortune of being Cara's line manager, and I 100% support you having this award. Your fairness is an absolute, it shines through in terms of how you manage the team, but also how you operate across the service. So how you speak about clients that we're working with, for example, in the huddle, you're really kind of focused on who they are and what they need, and that shines through. I'm so proud to be a part of this event and giving you this award today, because I think you really do deserve that.
I joined Camera's team in August, and since then, Cara has been very supportive. She's very approachable. She's a very approachable manager. The door is open, our office door is open. Anytime I'm having difficulty, I'm always going to her, Cara, how do I go about this? And she will take her time and show me things.
She's always bubbly, which helps when we have a difficult time. If there is a difference in opinion, she listens carefully, and she doesn't rush into taking irrational decisions. She listens to everyone, and that is very good. So thank you.
Cara's an amazing manager. I think everyone knows that I respect her in that sense, and she's always supportive.
Thank you, Jack.
I definitely want Cara as my manager. No, I've heard that.
The team make it easy because they're all really nice to work with. They make it easy. Thank you, everyone. Well done. Yeah.
Congratulations, Cara. You're a true inspiration. And thanks to Neil Springham, Director of Therapies, for his help in surprising Cara with her award during Alex Greenchester's Values Workshop. Congratulations to Marlene Cork and Femi Adebayo, our very worthy, highly commended award winners. You should all be very proud of your achievements. We wish you, Marlene, a very happy retirement and a massive thank you on behalf of the Trust for your incredible commitment to our forensic service users. And well done to everyone who was nominated.
Hello, I'm Sue Souter, Lead Governor of our Council of Governors. Our Governor's Award is for an individual who has gone above and beyond to put the Trust values of we're kind and we care into action. The winner has been chosen by a panel of governors who are looking for an exceptional individual who is not afraid to go the extra mile to make life better for those who need our help. We had a fantastic response with over 150 nominations. With so many brilliant entries, it was a hard job for us to decide who the winners should be. The 4 to make our final shortlist are Susan Atkins, Community Staff Nurse, Oval District Nursing Team. Sue received a lovely nomination from the wife of one of her patients. By taking her holistic approach, Sue has made a major difference to his mental health and outlook on life. The nomination ends. Sue is one of the most brilliant, caring nurses it is possible to find and is a great ambassador for Oxleas and the Oval team. Karen Edwards, Social Inclusion Worker, Forensic Outreach Team. Karen supports our service users to reduce their social isolation and improve their recovery. She uses her excellent partnership working skills and ability to build trust relationships to meet clients' needs. Karen is described as having a big heart as an extremely valued member of the team. Lara Odukaya, Community Psychiatric Nurse, Bromley West, PCP/ADAPT. Lara received a moving and emotional nomination from one of her service users. The nomination says, "I will always remember the first time I met Lara. I could barely stand and she said, 'I believe you.' These 3 small words made me want to live. My journey from that point with Lara is one of unbelievable strength and kindness. She made me become me again." And Helga Crowley, Cardiac Rehabilitation Exercise Specialist, Community Heart Failure Team. Helga and the team came together to keep their services running during the COVID lockdown. Through Helga's hard work, the first virtual cardiac rehabilitation session took place in April 2020. It has now become a regular part of the service offer. Helga received a number of nominations from her service users. With so many amazing nominations, it was impossible to find one overall winner. And so I'm delighted to announce that we have joint winners for the Governor's Awards. Let's see who they are.
I'm Andy Trotter, I'm the chair of the Trust, and sorry to interrupt your day, but actually it's a bit of a subterfuge, if I'm really honest, because this is a recognition award for one Kerrin Edwards.
Thank you! I was only going to say, I was
This
so
is
shocked.
the
Thank you.
Governor's Award. You had so many nominations. I won't read them all out, but there's outstanding work to support clients and building trust and respect. Dedicated, incredible, outstanding, nothing is too much for her. So really wonderful, wonderful nominations.
I don't want to cry now.
So,
Fantastic.
on that, apologies for interrupting, but what a great way of doing it, eh? And Karen, this is for you.
Thank you so much.
And well done and congratulations, and thank you for everything that you do. So so many of these, not only from your colleagues, but from your clients as well. And there's been loads and loads of them. And so here we are. So this is the Governor's Award for you, and really, really well done. Well done.
Everyone, I don't know what to say. I'm crying now.
Yeah. And this is, sorry.
It gives me great pleasure as the lead governor to give you these lovely flowers on behalf of the award. I haven't read all the endorsements for what you've done. I think it's incredible. So
thank
they
you
can't
so
do the
much.
clapping, but we can do that.
Thank you very much, everybody. Thank you. I just so unexpected. We really have. I just don't even know what to say. Just thank you all so much. And I wouldn't be able to do it without the team anyway. So everybody else that's puts all their involvement in. So thank you, everybody. Thank you all.
All I want to say is congratulations for all of your hard work, for everything you do for our patients and for your team. So you should be very proud of yourself.
Oh, thank you. I'm in shock at the moment. Oh, goodness me. Thank you. Honestly, I don't even know what else to say. I can't say anything else. This is amazing.
Welcome to cardiac rehab.
Interrupting something?
We're running our cardiac rehab exercise session.
Right.
Come in, everybody.
How's it
Well,
going?
as many as you're allowed.
We've come with cameras, right?
Oh dear.
Yes. You're wondering what this is all about then?
Yes.
Yes.
Hello.
Are there people you know?
So many familiar faces.
I
yes.
know. So,
Hello.
so we've come specially for you.
Cuddles.
You know that, right?
Yes. Well, no, I didn't.
Well, now you know. Now you know. Now we know
dear.
because you've won an award.
Oh my goodness.
Loads and loads of nominations because of all the good work you did, particularly during the pandemic. And people have just been so excited.
I'm so nervous.
You don't need to be nervous. This is you doing a great job, and we're here to just say thank you.
Thank you.
Thank you, and to give you this lovely award and many other things that others will give you for all the work you've done especially starting the exercises online.
Thank
For
you.
which lots and lots of people sent in nominations to say thank you.
Please don't check my heart right now.
So this is for you.
Thank you. Are you allowed a
Helga.
handshake?
Hello, Helga. I'm Rebecca. I'm a staff governor, and we thought you were really well deserving. And that's your trophy, your certificate.
You've done amazing, but that's down to you and all the help and all the,
your support in the background.
And yours.
Well,
I've never known anyone to be able to push her as much as you. No one can get away with that.
Thank you the team, thank you for everyone, thank you Sharon for nominating, for being such a star patient, thank you everyone. I'm short for words, which is really rare. really rare. Thank you everyone. I'm chuffed. I'm absolutely chuffed.
You deserve it.
Well deserved. I'm honestly shaking, which is really unusual. My heart
As her team lead, she's been amazing, very resilient, and even when the COVID hit, she was just on the ball. Even when everyone was so scared, Helga was out there working every day tirelessly to put up the programs for the patients. So she really and thoroughly deserves it. Well done.
The thing is with Helga is you're never standing still, all right? So she's looking for the next thing all the time, always moving forward. Some people can easily sit back and be a bit complacent, but not with Helga. You're always looking for the next thing. So that's why we love you.
And we had 50 patients face to face across 2 different venues, across 5 different classes. We couldn't just sit down and say, yeah, this is COVID, this is different, that's the end of it. We had to sit down and design programs for people that were suitable, the walking programs, which was all new, it was all done from scratch. And then the online, and then on the 3rd of April, which was 2-3 weeks into lockdown, we had the first online session, which, was unheard of in cardiac rehab for starters. Possibly one of the first, if not the first in the country, doing an online and live online session. But I could not have done it without the team behind. So thank you everyone, and not so thank you for keeping this quiet. But thank you the team, and thank you for all the patients and all the staff and the governors for being behind the service. Thank you. Thanks for your time and your presentation.
Well done to Karen and Helga for their thoroughly deserved recognition awards. Thanks to Andy Trotter for joining me to present Karen's award, and to Ife Okosha, fellow Governor Rebecca Marks Hubbard's service user Sharon Flack, and her daughter for joining me for Helga's surprise. We must also give praise to Susan Atkins and Lara Odukora, who pick up the highly commended award. Very well done to you both.
Next is the Adult Learning Disability Team of the Year Award. These are the 3 shortlisted teams. Intensive Community Support Team. The team has worked hard to support people going through challenging times, their families and networks, in order to prevent hospital admission, placement breakdowns, and to improve their quality of life. The team show concern and thoughtfulness to the welfare of clients, doing their very best to meet their needs and promote the voice and best interests of the person with a learning disability or autism. Greenwich Community Learning Disability Team. Despite many challenges, the team has adapted the way they work during the pandemic and has continued to provide a high quality and safe service to our service users, families and carers. New projects have been embraced for the benefit of our service users, including a fun and fitness group, the Believe in Us project, and a carer support group. And the ASD team. This small team has faced the challenge of meeting autistic spectrum diagnostic demands by adapting their ways of working through COVID. Working closely together and building relationships with other departments, they have a positive impact on patient care. The team are also looking at new ways of using technology, including trialing an app with some service users to aid their self-management and with the aim of a reduced risk of hospital admission. Let's find out who has won.
excuse me for interrupting. But, I'm here to present the Recognition Award to the Intensive Community Support Team. So fantastic, ALD Team of the Year. And wonderful, and the write-ups are brilliant. Who do I present this to? This magnificent award. Well, there we are. There we are. Well done. Congratulations. I mean, the write-ups have been fantastic. So I just want to congratulate you all for absolutely brilliant efforts. I mean, I won't read them all out because there's so many of them, but inclusive and welcoming to new members of staff, kindness and consideration to team and clients, high levels of concern and thoughtfulness. The team listens to concerns and worries of family members, clients and support staff. Worked hard to support people with learning disabilities through challenging times to improve their quality of life. I mean, fabulous write-ups. And then you had a brilliant letter. I don't know if you've seen this letter recently that came through.
Thank you, yeah. It was lovely.
Yeah, it wasn't it? And it summed up some really brilliant things. And then talking about your team before this as well, about the way you react so quickly to the challenges and get things done and make people's lives better. There's nothing, it can be nothing, no greater accolade, I don't think, for what you do. So thank you, each and every one of you, for everything you do to make people's lives better, which is what we're here for, aren't we? Anyway, congratulations, and really, really well done.
On behalf of all of us in the ALD Directorate, we want to give all of you this certificate, just to thank you very much, and also to thank Bethan, of course, because Bethan was one of the first people to set up the intensive support service, weren't you? So you and Hannah as well, and Rosamond as well, who worked tirelessly to get this team set up. So to all of you, thank you so very much, and it's very much appreciated by all of us, all the hard work that you're doing. So thank you. So I'm going to give this to you on behalf of...
If it wasn't for COVID, I'd give you Well, I think Sandra said it all. Thank you, Beth, and thank you, Rosamond, for your support to the team, because I think we're definitely within a wider team, and we really feel that, and couldn't do it without that wider team. So thank you, and yeah, isn't this nice? Thank you.
It's just a privilege to be in this team, really, and the wider team as well. We do feel lucky. We have great colleagues, and yeah, let's keep up the good work.
Like I was mentioning before, it's been such a nice journey from the beginning, and all the changes that have been made, and the team's brilliant. Everyone's great at just working together and holding our values. So yeah.
I think, kind of reflecting back on what Ruby has said, I think we all have similar values, and it's really nice that we're always working towards the same goal, and it's just really nice to be with you, all 5 of you, and with obviously the wider team. So yeah, I feel really lucky to be part of this team.
I guess I've only been part of the team for the last 2 months, but I've just been really struck by how the great work that this team has already been doing for such a long period of time, and the care and attention that is given to every single client and their network and their family. I think it's a really beautiful thing, and it's something that I've really enjoyed being a part of.
Yeah, well, I suppose I think obviously yourself and Rosamond have kind of laid the foundations for this team to come into being, and we were just reflecting today on how, even though the kind of members of the team have changed, there's been a kind of thread of continuity. So there's kind of brilliant new resource that comes to the team, but also something about kind of the way of working, of kind of really working collaboratively and kind of making really sort of lasting, trusting connections, I think, with kind of clients and their families that's, yeah, endured. So that's really lovely to hear.
Thanks to Andy Trotter for helping us surprise the team with the help of ALD Clinical Director Sandra Baum and Rosamond Roach, Consultant Clinical Psychologist. Very worthy winners, and congratulations also to our highly commended teams, ASD and Greenwich Community Learning Disabilities team. Well done to everyone. You should be very proud of the services you provide to our service users with learning disabilities. And now we move on to Children and Young People's Team of the Year Award. These are the 3 shortlisted teams for the Children and Young People's Directorate. Bexley CAM's admin team. During the pandemic, the team has been a point of contact for clients, their families and carers, ensuring that while clients are waiting, they feel safe and comfortable. Our carers and children know every one of the admin team. The team has put systems in place to ensure CAMS staff can work safely. They have been instrumental in enabling and keeping Bexley CAMS functioning at its optimum. Bexley Speech and Language Therapist. The team has worked to ensure our most hard-to-reach and vulnerable children and families had regular contact or face-to-face appointments throughout the pandemic. In the summer holidays, children known to this service who were starting in reception in September were assessed to ensure care plans were in place to support them. The team are participating in a QI project on bilingualism and service accessibility. And our immunization team, the team has been instrumental in maintaining the essential public health role of school-aged vaccinations, striving together to deliver the best possible service they can across Greenwich schools and setting up community clinics in venues outside of Oxleas. They have negotiated with schools and outside agencies to provide the best service for our users and ensure accessibility has been maintained. Let's see who won.
Surprise! Do come in, Paula. Hi, Vicky. Paula, you thought you were just showing some directors around the building.
I did, yes.
Well, you are, but also we're here for something else as well. So can I just check, this is the CYP Speech and Language team?
Yes, from Bexley, yes.
Excellent. Yeah. Well, I am delighted to let you know that you have won Team of the Year award for CYP. So congratulations. Here you go. Here's your award, which I present on behalf of the Trust.
Look.
Fantastic. Really, really well deserved.
Oh, thank you. That's a huge surprise and really amazing. Thank you so much. Yeah, I mean, my team is just absolutely brilliant, amazing. They've just worked so hard over the last couple of years. And gosh, I can't think what to say. I'm sorry, I'm speechless.
No, fantastic.
Yeah, I couldn't hope for a better team and group of people. They're so dedicated and hardworking and committed to working for the families of Bexley, basically. So thank you so much. This is great. Thank you.
Well done. Really well done. How are you feeling about it? Just to put you on the spot.
Oh, really, really thrilled. This was so unexpected from all of us, and we couldn't have a better service lead either to lead our team. So thank you, Paula, for everything you do.
Thank you. Anybody else like to say anything? Everybody's gone camera shy.
I think, yeah, it's just an absolute privilege, I think, to receive the award on behalf of the whole team. Obviously, you know, the team is as good as the leader, and Paula certainly does lead us from the front very well. Yeah, and it's a great recognition on behalf of everybody in the team.
Fantastic.
So thank you very much.
Fantastic. Anyone else like to say anything? Vicky, would you like to say anything?
Obviously, sorry is my first thing, Paula. So I've spent the last 15 minutes, she's been asking me who's coming, what they're here for, they've even lined up families for you all, you know, like she's put so much, but it just goes to show the dedication that Paula has for the team and the service, and yeah, all of them, they go above and beyond for all of the children and young people of Bexley, and we get fabulous comments. The parents think so highly, as do we all, so it's very well deserved. So I'm sorry, Paula, but well done.
No, very well done. Anybody else like to say anything? I'm going to put you on the spot.
No, it's just very unexpected, but yeah, it's an amazing team to work for, and we have worked very hard over the last couple of years, so yeah, thank you.
Excellent. So I was just going to let you know kind of what was highlighted when you were nominated for the award. So I think two things really stood out. One was around the fact that you worked extremely hard during the pandemic and adopted and adapted the way that you work in order to help families access the service. So I think a few things were highlighted with that. There was the hard to reach service and supporting families who struggle to engage with services, but also the school riser appointments that you put into place for reception age children. And then the second thing that you were highlighted for was your work around inequalities, which really fit in with the values of the organisation and building a fairer Oxleas. So I know that you've worked with an organisation called Chicken Shed on their unconscious bias training, and you're also doing some work around turning that into a QI programme. So I think two excellent pieces of work there. So thank you ever so much for everything you do. I think, you know, fantastic team, really, really well deserved award, and yeah, many congratulations.
Thanks to Chief Operating Officer Ian Diamond for surprising the team. Well done to our highly commended teams, Bexley Camps Admin and our immunization team. And congratulations and very well done to all of you, and thank you for the fantastic services you provide to children, young people and their families. And now our Forensic and Prisons Team of the Year Award. Our three shortlisted teams for the Forensic and Prisons Directorate are Early Days in Custody Mental Health Support Team, HMP Emley. This team, which is based with operational uniform staff on the First Night Center induction wing at the prison, interview every man new to custody and address any immediate mental health needs. They then refer or signpost men to the services they need, and despite the team only consisting of 2 people, they have had complete cover throughout COVID, with every new man to custody being seen. Forensics Service User Forum. The Bracton Service User Forum has been running for nearly 17 years. Representing the voice of service users within the Forensic Directorate, the Service User Forum has led a number of strategies and changes, significantly improving the quality of life of service users. And all Bantu support workers. Our Bantu support workers have provided compassionate care to patients during the pandemic. These members of our team are recognized for the support and work they put into our services, which is often difficult and challenging. They are our lowest graded staff, but without them, our services will not function. Their approach to patient care is truly based on the trust values of caring, kindness, and listening. Let's see who the winner is. With conversation. Morning all. You all good? Yeah? Sorry? You want me to come through? You sure you want me to come through? Okay, so what do you want to say to me then? Huh? I know you come from, the Directorate is large, you come from lots and lots of different areas, but here is your award. Who's going to come get it? Well, you are sat up front, so they say it's got to be you. So congratulations. I've got to read the stuff that people have said about you here. He says that these members of our team are recognized for the support and work they put into our services, which is often difficult and challenging. It then goes to say that you're some of the hardest working staff who go the extra mile to support patients and clinical teams. You're often the frontline staff who have to deal with patients, particularly when they become unsettled. You show kindness and compassion, are absolute values in Oxleas. You're caring, you're supportive, you're open, honest, and you support both staff and patients in a non-judgmental way. And then he reads that this directorate would not be successful without you. And for that, I really want to say thank you.
This is a great trust to work with, and yeah, I like how everyone looks out for us. No, I'm shy. Thank you very much.
We think that they more than deserve this. It reflects the quality of staff that we have within this part of the organisation and the hard work and dedication that they have.
So again, congratulations. I've heard all the things you say you want to do. Your managers are here, and I'm sure they'll be bending my ears as we seek to do what's best for you all. Well done to Bantu support workers, and thank you to Fanatzai Hove and Somaya Hussein who helped me to arrange this surprise. I'd also like to pay recognition to our highly commended teams, the Early Days in Custody Mental Health Support Team and the Forensic Service User Forum. Thank you to everyone working in our forensic and prison services. We know these can be challenging environments, and the care and compassion you show towards the people using your services and your colleagues remains an inspiration to us all. And now we have arrived at our final award, our Corporate Team of the Year award. The shortlisted candidates are COVID-19 Vaccination Team for designing and delivering the vaccination program which has run from January to December 2021 and administered over 8,000 jabs, first, second and booster in total. As well as Oxleas staff and staff from local partners receiving the COVID-19 jab at Queen Mary's, over 400 patients also received COVID-19 vaccinations from the team. Hoc Team Informatics. The team helped develop and maintain daily reporting to NHS Digital from April 2020. Working with ward staff and real transformation, they improved data capture and reporting processes, moving away from manual processes. A new report on Real enables wards to access real-time reports with information on swabbing and test results to help manage patients. And our safeguarding team. The team have been promoting a Think Family approach. The pandemic has given rise to a new safeguarding challenge across all ages. The team took a proactive approach of collating any emerging themes to find new ways of working and ensured robust communication with partners to promote understanding of the rapidly changing service offers in response to evolving national guidance from the start of the pandemic. Let's see who the winner is.
The questions around the staff survey. Karen, can you pop in here for me? This is a bit on the spot around the staff survey. I'm so sorry to put you on the spot like this.
Hello everyone.
Hello.
Okay, it's not about the staff survey at all. I'm Rachel Clare Evans, I'm Director of Strategy and People, and I'm here with some fantastic news, which is to say that you, the COVID vaccination team, have been successful as the Team of the Year for our Staff Recognition Awards. Huge congratulations to you all. So we're here to wish you many, many congratulations for a fantastic job. I mean, everybody speaks so highly. When they come here, you treat people so well. And you've done amazing things over the last year, and we're really proud that you're our Corporate Team of the Year. We really are.
Thank you very much.
So who can I hand this over to? Who's willing to take it? Go on then.
Thank you. Thank you very much.
You will also, yay!
To the team.
To the team.
Really proud of them. They moved mountains to get this done. Do I have to say that again?
Yeah.
I'm really proud of you all. You moved mountains. You've done brilliantly. Thank you.
And how's it been for you? How have you found it?
It's really good.
Yeah,
It's been really
enjoyed
good.
it.
Yeah.
It's been nice meeting everybody again, seeing everybody again. It's been
In
really
person.
nice.
Yeah. Lisa,
Yeah,
and saying to me, oh, I saw you last time.
I haven't seen you for
Seeing
ages.
people we haven't seen since I was retired.
And people coming back going, oh, you did my last one. Oh, can you do my third? It's been really nice. It's been nice to see so many people having the flu at the same time as well. I think that's really helped.
Really has.
Seriously, the feedback from people about how nice it's been to come here and how warm and welcoming you've been to them, it really has made a difference. So it is really nice. So big congratulations from us to you, and I hope you get a good chance to celebrate.
Thanks to Director of Strategy and People Rachel Claire Evans for surprising the team, and to Director of Nursing Jane Wells for your help too. Very well done to everyone who has been involved in making our COVID vaccination program such a success, both behind the scenes and in the clinics. It's been a truly remarkable effort to develop and mobilize such a complex vaccination program at speed and in the midst of a pandemic. As well as the senior nursing and AHP colleagues, many of whom gave up evenings and weekends to support this smooth delivery, I'd also like to take a moment to thank the team who supported the program behind the scenes in terms of the vaccine ordering, storage and delivery, configuration and management of the staff booking system, supporting staff queries and appointment changes, administration of consent forms and providing staff with written resources or record cards, and finally, the reporting of data. These include the pharmacy team led by Paul Maycock, Tina Allen and the team, quality assurance, Ellen McGowan, IT, Anthony Elisak, Quib Mary's ALD team, admin team led by Joe Ruffrey, and other admin who supported the clinics via the staff bank. Thank you to each and every one of you for your incredible achievement. I'd also like to say well done and thank you to our highly commended ad hoc and safeguarding teams for your outstanding work.
Thank you, colleagues, for revealing the 2021 Recognition Award winners. Congratulations to them and to all those who were nominated, and thank you to everyone who took the time to nominate people. Before we close, we'd also like to recognise our staff who've passed long service milestones for their work at Oxleas and within the NHS in general. As we can't have a face-to-face event to acknowledge them, each directorate will be honouring them locally. Here now is a short film to let you know who are being given long service awards this year. Thank you to you all, and your certificates and badges will be on their way very soon. 2021 has been another difficult and challenging year for us all, but it's at times like these awards that we are reminded why Oxleas is such a great place to work. The nominations we received this year really highlighted the care, compassion and kindness you show to our service users and to each other, and I couldn't be more proud to be the chair of Oxleas. Thank you to each and every one of you.
And a big thank you from me too. As we can't celebrate in person, let's celebrate together using our social media instead. Don't forget to use @Oxleas NHS, hashtag Oxleas Recognition on Twitter, or message us on Facebook to celebrate your wins. And please use this opportunity to congratulate your colleagues on their achievements too. Details of all the awards will be on our website alongside the special awards program. And many thanks to the communications and engagement teams for creating this year's virtual award ceremony. Thank you for joining us today, and goodbye.